Vitamin A is a fat-soluble nutrient, essential for healthy vision, immune system, fertility, and skin. Symptoms of vitamin A deficiency include vision trouble, difficulty conceiving, dry or inflamed skin, chest infections, and more. There are two types of vitamin A found in foods: preformed vitamin A and provitamin. A preformed vitamin A is also known as retinol and commonly found in meat, fish, eggs, and dairy products. On the other hand, the body converts carotenoids in plant foods, such as red, green, yellow, and orange fruits and vegetables, into vitamin A. Those at highest risk of deficiency are pregnant women, breastfeeding mothers, infants, and children. Cystic fibrosis and chronic diarrhea may also increase your risk of deficiency. Here are 8 signs and symptoms of vitamin A deficiency. Dry skin vitamin A is important for the creation and repair of skin cells. It also helps fight inflammation due to certain skin issues. Not getting enough vitamin A may be to blame for the development of eczema and other skin problems. Eczema is a condition that causes dry, itchy, and inflamed skin. Several clinical studies have shown alitretinoin, a prescription medication with vitamin A activity, to be effective in treating eczema. In one 12-week study, people with chronic eczema who took 10 40 milligrams of alitretinoin per day experienced up to a 53% reduction in their symptoms. Keep in mind that dry skin can have many causes, but chronic vitamin A deficiency may be the reason. Dry eyes. Eye problems are some of the most well-known issues related to vitamin A deficiency. In extreme cases, not getting enough vitamin A can lead to complete blindness or dying corneas, which are characterized by marks called Beteau's spots, dry eyes, or the inability to produce tears, is one of the first signs of vitamin A deficiency. Supplementing with vitamin A can improve this condition. Night blindness. Severe vitamin A deficiency can lead to night blindness. Several observational studies have reported a high prevalence of night blindness in developing nations. Due to the extent of this problem, health professionals have worked to improve vitamin A levels in people at risk of night blindness. In one study, women with night blindness were given vitamin A in the form of food or supplements. Both forms of vitamin A improved the condition. The women's ability to adapt to darkness increased by over 50% over 6 weeks of treatment. Infertility and trouble conceiving. Vitamin A is necessary for reproduction in both men and women, as well as proper development in babies. If you are having trouble getting pregnant, a lack of vitamin A may be one of the reasons why. Vitamin A deficiency can lead to infertility in both men and women. Studies show that female rats with vitamin A deficiency have difficulty getting pregnant and may have embryos with birth defects. Other research suggests that infertile men may have a greater need for antioxidants due to higher levels of oxidative stress in their bodies. Vitamin A is one of the nutrients that acts as an antioxidant in the body. Vitamin A deficiency is also related to miscarriages. A study that analyzed the blood levels of different nutrients in women who had recurrent miscarriages found that they had low levels of vitamin A. Delayed growth. Children who do not get enough vitamin A may experience stunted growth. This is because vitamin A is necessary for the proper development of the human body. Several studies have shown that vitamin A supplements, alone or with other nutrients, can improve growth. Most of these studies were conducted in children in developing nations. However, a review of studies found that supplementing with vitamin A in combination with other nutrients may have a greater impact on growth than supplementing with vitamin A alone. For example, children with stunted growth in South Africa who received multiple vitamins and minerals had length for age scores that were half a point better than those who received only vitamin A. Vitamin A is valuable to overall health. However, too much of it can be dangerous. Hypervitaminosis A, or vitamin A toxicity, typically results from taking high-dose supplements over long periods of time. People rarely get too much vitamin A from diet alone. Excess vitamin A is stored in the liver and can lead to toxicity and problematic symptoms, such as vision changes, swelling of the bones, dry and rough skin, mouth ulcers, and confusion. Pregnant women should be especially careful not to consume too much vitamin A to prevent possible birth defects. Always check with your healthcare provider before starting vitamin A supplements.